Hi, I'm Samantha Ratcliffe, Certified Nurse Midwife at Reply OBGYN and Fertility in Cary, North Carolina. Welcome to Cycle Saturday, our new weekly update on issues of fertility awareness and cycle charting. In the future, we will be sharing information and insights on important topics in fertility awareness and answering your questions. Which brings me to today's update. Many of our fertility awareness-based method users have reached out recently with questions and concerns about charting and how it may be affected during this coronavirus pandemic. One of our cycle charters sent a question that I want to share with you today. The question is, I'm experiencing much stress and anxiety during this pandemic. How can that affect my cycle and cycle charting? So we know that both positive and negative stressors may delay ovulation. This can affect some changes in the biomarkers that we track. We also know that there are 3 biomarkers that we typically track when we are looking at fertility awareness-based methods, and you may be choosing to chart 1, 2, or 3 of these different biomarkers. The first one is temperature, and you may notice that if you are charting temperature in, say, the symptothermal method, you could notice a delay in this temperature if you're having a stressor in your life. If you're charting cervical fluid methods, you may either notice a delay in fertility fluid, high quality cervical fluid, which is stretchy or clear or slippery, or you may notice patches of this fluid. This could last for a longer time than usual. And if you're charting with a fertility monitor, like in the Marquette method, you may notice that there is an extended period of high fertility and you may have to reset the monitor. Some women notice that their cycles are not actually affected by stressful times like this, and you may not notice that till the end of the cycle. So typically our advice is to just continue charting and wait till the end and look at the big picture. Ways that you can support yourself during this time are steady dietary habits, focusing on sleep, and avoiding alcohol. That can be hard to do for all 3 of those things, especially during more of an isolating time like the self-quarantine. But really focusing and honing in on these things can be a big help. One of the other common questions that we've gotten during this time is, what if I become ill with coronavirus or another illness while I'm cycle charting? How will this affect my cycle? The first thing we want to point out is that the effects may be the same as any other positive or negative stress. So anything that we talked about in the first question, you may simply notice a delay in ovulation or changes in the things that you're tracking. But the other things to pay attention to are related to any illness that you may have. While our first priority for you is to make sure that you are safe and healthy and that you are not affecting others and potentially transmitting any illness, of course, you may always reach out to us with those concerns. We want you to pay attention to your body. So pay attention. If you're charting your temperature, look for the temperature shift. You may not be able to pick up on it. There's usually a place on your chart where you can mark illness. So for those users of the symptothermal method, you may not be able to check the same way that you used to, and you may notice when you had a fever, you're not able to see that shift with ovulation. If you're charting cervical fluid methods and you're taking over-the-counter medications to manage cold symptoms or even allergy symptoms, or trying to help with sleep with other antihistamines, this can affect your cervical fluid, and you may notice that in your chart. You may not notice the same kinds of changes with using the Marquette monitor or other urinary hormone monitors. However, still pay attention to different changes in your cycle that could be affected by the stress of simply having an illness in the body. What resources are available at Reply for me if I have questions during this time charting my cycle? As always, we are listening. If you're established in cycle charting education at Reply, reach out to your fertility educator through Patient Education in My Care Plan app. For more information about cycle charting, you can explore services and resources on our website, replyobgyn.com. We also created a decision-making tool guide. If interested in scheduling an appointment with one of our experienced educators to discuss this to prevent pregnancy, you can reach out to us. We have an educator team certified in several fertility awareness methods, and healthcare professionals who clinically interpret cycle charting. If you have any questions, please reach out to Lori Hartley, Director of Education, for a personal inquiry at 919-230-6702. If you are not yet a patient or client with Reply, please give us a call. We are equipped with telehealth visits and certified in several different methods of fertility awareness-based method charting. And you can always find us on our Reply social media channels or visit us on www.replyobgyn.com. We look forward to connecting with you throughout the week to discuss your topics of interest in women's reproductive health. Keep an eye on our social media channels where we will be giving you the opportunity to send us your questions. We hope you find these updates helpful, and thanks for tuning in this week.